It is my great pleasure to introduce everyone to Dr. Priscilla Chan. Born and raised nearby in Quincy, Massachusetts, Dr. Chan attended local public schools, graduated from Harvard, and has gone on to great heights as a pediatrician, philanthropist, risk taker, and optimist. Most of you will know her as the co-founder of the Chan Zuckerberg Initiative, an organization launched in 2015 that aims to advance human potential and promote equality in areas such as health, education, scientific research, and energy. When CZI launched, what caught most of the world by storm was the commitment to make medical breakthroughs that would enable humanity to cure, prevent, or manage all diseases during their daughters' lifetimes. That is a bold commitment. That is the kind of vulnerable risk-taking we've learned to associate with Dr. Chan. Perhaps few of you knew of Dr. Chan's local roots, or that before going to medical school at the University of California at San Francisco, she taught fourth grade science. Dr. Chan's commitment to public service continued during medical school and in her pediatric residency, where she frequently provided care in San Francisco's public hospital. And it continues to this day, not only in the global work of CZI, but in the intensely local work she has undertaken as founder of the Primary School, an initiative that integrates health and education and serves children and families in East Palo Alto and the Bellhaven neighborhood in Menlo Park, California. How important is it for people to understand that science shouldn't be just left to the professionals? How important is it for everyday folk to feel a sense of agency with science, to feel like they can use science and technology in our world?
I think what's important is this sense of wonder and progress that we're all able to be a part of. And I think the museum sort of opens, I talked about how the museum opens that door for so many young people. Like, you can discover things. You just did discover something in this exhibit. And I think seeing how that progress is happening today. When we had our, with SARS-1 in about 10 or 15 years ago now, it took a long time for us to even understand the genetic sequence of the virus. With coronavirus, we were able to sequence it within a month, and to be able to really have treat both medications and vaccines within a year and a half, that is a breakneck pace that no one would have been able to have even imagined before. And now we get to have that sense of wonder of, like, if we can do this together as a collective society, what else can we do to keep our community safe and healthy? The pandemic has obviously been devastating, but there are silver linings about how we can work together better and faster.
I think that leads to an important question and observation sort of about collective action, just what you just said, how academia, industry, government, and the public can rise up together to take on the problems we're facing. What are some of your hopes for the collective impact of these four sectors coming together to rise up to face the problems we're facing?
When you think about biomedicine, it is a huge ecosystem in which billions and billions and billions of dollars get spent every year. But I have to say that each one of these parts of the ecosystem have amazing superpowers. The discovery and creativity in academia is, especially in our country, I'm proud to say, is unparalleled. Our ability to translate things into medicines to safely treat people are top notch, but we lose a lot when we don't actually both acknowledge the strengths and how we can better work together and collaborate. And so, how do we actually acknowledge that we all play a critical role, try to eliminate some of those inefficiencies based on trust, based on communication, and then be able to bridge those more efficiently to be able to drive progress together?
What do you think your 80-year-old self would be saying to you right now, where you are, doing what you're doing? What does the 80-year-old Priscilla Chan say to Priscilla Chan?
Oh boy. I hope she says your joints are working out just fine and you're still surfing. So that would be good. Number one. And two, I would say, you weren't always right, but you made a big difference because you kept at it.
And what would she say about this part of your journey from brave thinking to brave acting? Because in 2015, this was a brave thought. And now you're just taking all these risks, you're jumping in. And what would she say about all this brave acting that you're doing now? What guidance would she give you?
I hope that the brave acting, which for me is being vulnerable, being able to take risks and say, I know this sounds wild, but we're going to go try it. That bravery, that vulnerability, turns out to be a superpower because it invites others to join in to be brave as well.
Thank you, Dr. Priscilla Chan. I think that those are the words we should leave for tonight. And we do wish you and CZI well in the brave things you're trying to do. And I hope that all of us will believe that what humanity has is the power to solve problems. That is what we were built to do, to find innovative solutions to the problems we face.